Well, the FDA is proposing tough new controls on some of the most commonly used prescription painkillers, making it more difficult for tens of millions of Americans to get access to drugs containing the narcotic hydrocodone. I hope I pronounced that correctly. Dr. Siegel will correct me if I got it wrong. He's a part of the medical aid team. Dr. Siegel, good to see you.
Greg, you got it right. Today we are talking about Vicodin. It's a combination of the powerful narcotic hydrocodone and acetaminophen, the most commonly prescribed painkiller in the United States, Vicodin. The CDC reported nearly 15,000 deaths from overdoses, more than heroin and cocaine combined. Vicodin is currently listed by the Drug Enforcement Administration as a Schedule III drug, Greg, carrying lower potential for psychological or physical dependence. You can get up to 5 prescription renewals without seeing a doctor, and it can be prescribed by a nurse or a physician's assistant. Now the FDA is recommending changing the category to Schedule II, which is intended for more dangerous and more easily overused drugs. After years of the FDA being reluctant to reclassify the drug, an extensive review of the scientific literature, recommendations from the medical community have led to a change of course, and they've said, quote, "In recent years, the FDA has become increasingly concerned about the abuse and misuse of opioid products, which have sadly reached epidemic proportions in certain parts of the United States." Now, some professional groups, including the AMA, and we just received a statement from them that they worry about legitimate use, especially in nursing homes and hospices being cut down from this. They and the American Cancer Society are against rescheduling due to these concerns that they would limit access for patients who really need them. Dr. Michael Weinberger, who's the director of pain management at Columbia Presbyterian, says we need to find a more effective way of allowing access to patients who do need them, while at the same time curbing abuse.
Hope is that tightening accessibility in some way might lead to reductions. We have a public health crisis related to opioid use, and we need to educate the public on the safe use of opioids.
Greg, to give you some perspective on this, let's look at some other drugs that are involved here. Adderall, Ritalin, those are Schedule II. Tylenol and codeine, that's Schedule III. OxyContin, which is very similar to Vicodin, Schedule II. So making this a Schedule II would put it in the neighborhood of more drugs that we already worry about. Greg?
All right. Dr. Marc Siegel, as always, thank you so much.
Good to see you.
Get more of the latest medical news on House Call, Sunday mornings at 10:30 a.m. Eastern, right here on the Fox News Channel.